Joseph's example shows what we can do in a normal treatment. High blood pressure, cholesterol, breathing problem, eyesight. Okay, tell us why you first came to see us for.
The major problem was the blood pressure and the breathing, and so and the cholesterol. Now, I was afraid of the side effects of the cholesterol medication and of the blood pressure medication.
How high were cholesterol?
The cholesterol was over 200. It was something, I forget what the ratio of the good to bad was, but it was over 200. And the blood pressure...
What?
It was close, no, not that. It was like 219.
Okay.
Something like that.
That's almost normal.
Well, I don't know. That's
but
not
your
my
doctor want
didn't
to
say that. No.
Yeah, well, they want to take you take drugs. Yeah.
So, but I was worried about what the statins would do, and then the high blood pressure. I was worried about this idea that you'd have to take CoQ10 because protect your heart from the blood pressure medication. So, and then there was the breathing, which was a problem, bronchiectasis, the destruction of the airways that was a result, I think, of what happened many years ago when I was in the service. But in any event, I've been bothered by colds and phlegm for all these many years. So I heard Dr. Tong on the air one day, on Saturday, he and Dr. Elaine, and I thought, well, couldn't hurt. Yeah. So my blood pressure it's quite a bit down. It's 20% down. It's still not great, but my cholesterol is down to 180.
Yes.
And
how about the breathing?
The breathing, I just had a breathing test lately, and it turns out that from being at what they call 50%, it was 50%, a little under 50%, or a little over. That's the perfusion, whatever that's called.
Pulmonary function test.
Yeah, pulmonary function. It's up to 61%.
So you improve 20%. That's a lot. Yeah.
And the doctor was quite amazed. Really, I mean, nice guy. I like him, pleasant fellow. And he said, "Well, just keep doing what you're doing." I said, "Well, I can't. If I told you, you wouldn't believe me."
Exactly. So how about your eye pain? You have eye pain today.
Yeah, well, I had eye pain from the very beginning when I came to Dr. Tong several months ago, but nothing happened. It improved a little bit. Today it improved a lot, and the visual acuity, we've been trying to get that to improve, and I hadn't noticed any difference until today. The idea of restoring the growth of hair on my scalp. When I was a fairly young man, I lost a lot of hair on the top. And it's been that way, and I'm a lot older now than I was then, and now some of the treatments have caused the hair to regrow on the top and the side of the scalp, top and the back. And the best thing about it is it's normal color. I really don't want to look like these guys my age who look like Mount Everest, with the snow on the top. So I like it that way. But the hair, people say, "Gee, something's different about you." I said, my hair is going, "Oh, come on, JR." Yes, it is. Okay. So, and those are the major things that have happened. And one other thing I will say, nobody believes this either, but I had a toe fungus, which I picked up in the Navy many decades ago, and I just lived with it. It's nothing to do for toe fungus except an experimental treatment, which is about 85% effective sometimes. And it costs a lot of money. Medicare doesn't cover it either. And then there's another thing which bangs up the kidney. You agree?
Exactly.
It's called Lamisil or something.
So our treatment improves circulation.
The treatment, and what happened was that it virtually, now it hasn't yet disappeared, but it virtually disappeared. And my podiatrist, who's a nice guy, I like him, a friend of mine, he said, "What do you do?" I said, "Well, I told him."
Okay, you remind me next time. We force it and get rid of it. I had the same problem. The nail was very thick, and now it's become normal. Okay, so it's all circulation, vision improvement, breathing, because you got the blood circulation to pick up the oxygen. Okay, the cholesterol, now you have less inflammation, less cell death, so the liver does not have to produce so much cholesterol. And then if you are more alkaline, your blood vessels start opening up because the calcification becomes less, and you have bigger vessels and less thick blood. So all had to do with circulation, balance, and this negative entropic energy, qi, that restore order.
All right, and I would just say one other thing too, that I have been an advertisement for Dr. Tong to my doctors, because every one of my doctors, guys who were friends of mine, and like them, I've known them, are sick. Yeah, but they won't come.
They'll get sicker with their treatment, okay? So I select to do this way because I don't want to use drug on myself or on my patient. So I became an anesthesiologist. So today, I just love this treatment. Just like I told you, I improve your eyesight. I told you I improve your hearing. I do that almost like with 1 or 2 treatments. But the long-term cure had to do with you sticking on the right kind of diet, and that is not so easy. Yeah.
That is true.